and thanks for tuning back in. My name is Shannon. I've been a physician assistant for 9 years, and today I wanted to talk about contract negotiations. So first I want to introduce my mom. This is Karen. She's been a nurse for 45 years, y'all, 45 years. So she started out in ICU. She was a house supervisor, charge nurse, manager of outpatient surgery, director of surgical services, and for the last 10 years, right before she retired, she's been chief nursing officer. So she has a lot of wisdom regarding nurses and contract negotiations. And I thought it'd be helpful for y'all to hear her opinion as well. So the first thing, this seems really silly, but dress professional, dress the part. It's really important to set the tone for the meeting. If you're doing contract negotiations, meeting with attorney, I think it's best to be the most well-dressed person in the room. It gives a little bit of confidence to you when you're negotiating. Second is, don't cry. There's, like League of Their Own, there's no crying in baseball. There's no crying in contract negotiations. Don't cry. I will say I have seen it work in one episode, but just don't cry. So the first thing that I thought was really important was having your salary survey. So for physician assistants, we have the AAPA. So every year they do a salary survey for physician assistants, and it's regional. So if you live in the East, West, South, it will break it down by specialty, hours worked, those type of things, and it'll give you a range. So it's good to know what other physician assistants are making, especially in your specialty. It will also give you a year or a breakdown per year. So it's like 0 to 5, 5 to 10. That way you know the average for how many years you've worked. Also, important thing to know is how your facility is going to negotiate, what they're negotiating off of. Are they negotiating off years served, how many RVUs you bill out, different things like that. So with physicians, they use different surveys like Sullivan-Carter, the MGMA, I think the other one is the AMGA. So with that, it also similar to our salary survey, but it breaks it down per region, per specialty, per hours worked, call, those type of things. So you need to know how your clinic hospital is going to negotiate for you. So at my facility, they're not gonna let me go over the 65th percentile. So if I've been here 9 years, they're not gonna go over the 65th percentile. So I think that's important to know.
If I can jump in. After I have been a chief nursing executive for a healthcare system, and the one thing that I would tell you is absolutely be prepared. Shannon's made some really good hints on dressing the part, power dressing, but be prepared. You are going to, every healthcare system or every healthcare facility has a team of legal experts, if they don't have a legal department, or an HR department that is very well versed on salary data, negotiations, and contract. So coming in and assuming they are going to negotiate for your best interest is a fallacy. They are not. They are negotiating for the organization's best interest. And so be prepared. Look at the Sullivan-Carter data. Look at the MGMA data. The other piece is when we are negotiating with nurse practitioners, and we live in Montana, and they will bring salaries that are comparing California, for example. We don't compare salaries in California. Every organization will have a compare group. Ours happens to be Idaho, Wyoming, North and South Dakota. And so you're not going to make in Montana, for example, what a nurse practitioner or a physician's assistant in California makes. So be prepared. If at any time you feel, know what you want, I guess is the other thing. Know what you're looking for as far as negotiation. What do you bring to the table? If it's a renegotiation, have you done anything in the past 12 months? Did you take on hospitalist duties, for example? Have you taken more call? Do you serve on committees that benefit the organization? Every hospital in the country is looking to decrease the amount of discharge time for a patient. If you're in an orthopedic specialty, what have you done? Could you do? What future plans do you have that you could decrease length of stay for total joints, for total knees, for back surgeries? What do you have that's valuable to bring to the table? And the last thing is if you feel like you are at a point where you either are going to become emotional or you're going to become angry, check yourself and then say, I appreciate the time you've taken with me. I appreciate all the points, and I will have my attorney take a look at this. And my final point I could recommend to you is always have somebody, a legal counsel, that is going to do the final review for you, because I will tell you again, they are not negotiating in your best interest, they are negotiating in the organizations. And even the best organizations in the country, and I had the opportunity to work for Mayo Clinic, which I dearly loved, and they are a fabulous organization, but they have a budget as well. And so you want to be compensated fairly for what you do, for the years of service that you have, and what you bring to the table. So think about what you could bring to the table, what a difference. If you can decrease a half a day off a length of stay for a total joint or a total hip, that saves the organizations millions of dollars. And in some negotiations, that would benefit by giving you either an incentive bonus at the end of the year or by adjusting your salaries. Just things, pearls of wisdom to think about.
The other thing is knowing your range that the clinic or facility you work in is going to pay. So if you're an MPPA, are they starting at $30 and they're going to end at $70? It's good to know what ceiling you're up against. The other thing that's really important is knowing what the RVUs are that you build out. So the RVU is the compensation model that's being used, I think, at several large hospitals around the United States anyway. They're looking at how many people you're going to see. That all breaks down into an RVU. So knowing how many RVUs you have actually billed out compared to what you make is also a powerful tool to use.
Excellent.
If you make $120,000 but you bill out $500,000 a year, that's a good bargaining tool for you to use. If you know that you're coming close to that ceiling, the other thing that they can do is a discretionary bonus. If you know how much you bill out versus what you make, you can ask for a discretionary bonus that they will likely be more willing to give you versus a salary increase. The other thing that might be negotiable is time off. If you have 6 weeks of time off, they might be willing to go for a few more days. The other thing is CME money. So if you have $2,000 in CME money, you could ask for $3,000 in CME money. That might help make your total compensation package a little bit better. The other thing that facilities are starting to use is the total compensation model versus yearly salary. So when this was given to me, it wasn't very helpful.
To understand what the organization pays as far as health insurance or life insurance or what other benefits that you get besides your salary, which to most worker bees doesn't mean anything. Because you want to know what you're going to bring home every 2 weeks in your check, because that's what you're living on and that's what you're paying the bills. Shannon makes a really good point. Everything's negotiable. Everything in life is negotiable. And don't be afraid to professionally and respectfully put anything on the table. They may remove it, but you may ultimately accomplish something that no one else has. Go in with confidence, dress the part, be prepared. Know exactly what your salary surveys, know what other hospitals, if you have peers or friends in other hospitals that are doing something different or rewarding people differently. A friend of mine has a daughter who is a PA at Emory, and when she takes call, she gets another day and a half off during the week, that without any responsibilities to spend with her children. That doesn't happen in the organization where Shannon is, but that's something to think about, something that mid-levels are needed, they are respected, they have a clear place with the medical staff. Don't be afraid. Don't be afraid to go negotiate what you want.
The other thing I wanted to talk was new grads. So new grads, I feel like when you go into negotiate, you're kind of going to get what you get. And to a certain extent, that's true. The organization is putting a lot of time and a lot of money into training you. But that doesn't mean you can't negotiate certain things. So you can try to negotiate your salary. You can ask for whatever you want. They might say no, but you can ask. The other thing is sign-on bonuses. Lots of organizations will give a sign-on bonus, especially if they are in need of your services. You can ask for student loan repayment, or if you live in an underserved area, the government will give you money to work in that area for a certain amount of time. So that's another thing to look at, especially if you have student loans. You can try to negotiate your CME, you can try and negotiate call, everything is on the table. I think the biggest thing though is going to be turning your weaknesses into strengths. and your big weakness is you don't have any experience. But that can also be your biggest strength. If someone comes in with 10 years of experience, they've already created lots of habits that a supervising provider might not like. So if you're new, you don't have any of those. You're malleable, you're trainable, and that can turn into your biggest strength. So you might want to work that into the conversation, especially if you're feeling lowballed where you are.
And if you are in an area where your services are desperately needed, will they try and say, no, we've never done that? Maybe. That's where confidence and preparation goes a long way. And you may have to be willing at some point to say, I don't know if this is going to be a good fit for me or not. I appreciate your time. I need to think about this. A lot of times they'll come back and give you what you want, especially if they need you. And if they feel like you bring value to the organization and you're committed to them, and you are willing to look in the future how to save them money, how to decrease length of stay, how to provide compassionate care to patients, and you have a great work ethic, they'd be foolish not to.
One more thing, when doing your negotiation, there are bonuses. So you can have quarterly bonuses, yearly bonuses. Some will want to wrap that into your total compensation, but if you're already hitting that ceiling that we talked about, they may be willing to do quarterly or yearly bonuses depending on certain criteria. So some might be RVUs. If you bill out a certain number of RVUs, they'll give you a percentage paid back depending on how much you bill out. That might give you more days off. They could give you more CME. So that's negotiable also. So number 1, dress the part. 2, don't cry. 3, know your information. Okay, how much are you people getting paid in the West, East, and have a number in your head that you want. You might not get it, but you should have a number of what you want. And then be educated on what the clinic or the facility that you're working at is negotiating. Are they negotiating your service? Are they negotiating RVUs? Know what they're negotiating at, and that will help you. Do you want student loan repayment? Do you want more time off? Do you want more CME? Do you want to take call? And then what specialty, are you working in? Sometimes the specialty will give you different types of bonus opportunities.
And my final word, unless you are an expert at reading contracts, have a legal representative, pay an attorney for 15 minutes or 30 minutes of their time to review it so you have someone who has your best interest at heart. Sometimes contracts, one word in a 15 or 20 page contracts makes a huge difference. So in the end, plus when you tell the people that you're negotiating with that you'd like to have your attorney take a look at this, just to take a final look-see, if you will, that tells them that you are more prepared than 90% of the people that come in to negotiate a contract. Not threatening, be respectful, be professional, but have someone that represents your best interest who reads contracts every day take a final look before you put your signature on it.
That's true. I do that. I have my attorney look at all the new contracts that I sign, just because you're a PA, you're a nurse practitioner, you're pretty dang smart. These contracts are written in a whole different language.
Yep.
They're kind of meant to be really vague, and you want to know what you're signing, because what you're signing is legally binding for the next 2-3 years, whatever the contract is. I guess that's another good point. Know the amount of time you're signing that contract for, and if you can easily get out of it or not, but your attorney will let you know that. So know what you're signing. If you have questions, know what every single word in that contract means. Google it, get on the dictionary, look it up, know what everything means. If anything is vague, ask your attorney. Please know what you're signing, because that's how you're going to be working and how you're getting paid for the next 2 to 3 years. All right, hope this helps.
Thank you.
Yeah. If you like this, give me a like, comment, subscribe. Have a good day.
Bye.